Justin Herbert is recovering from rib cartilage fractures, while the head team physician responsible for his care is being sued in relation to his management of a rib injury in a previous athlete, Tyrod Taylor. Yep, you heard all that right. Welcome back, everybody. I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about medicine and the human body in relation to sports medicine topics, then please be sure and subscribe to stay up to date with all my future videos. Herbert took a lot of big shots during this game, but the one that really seemed to kind of be the final straw was here when, as he's going down to the ground, he almost lands with his left side on top of the defender's helmet. And what this is going to do is just put a lot of pressure on that left side of the rib cage. I'll be very honest, in the moment, I was worried about an organ injury, like a spleen injury, kidney laceration for Herbert, just because of how much pain he was in. But of course, we've since found out that it was a rib cartilage fracture. Pay attention here too to when Herbert was trying to take off and run, he kind of holds up and it's almost like he doesn't want to extend his thorax and kind of bend backwards, which is going to be pulling on those ribs. When most of us hear about cartilage, we think about either the lining on the ends of bones, like cartilage in our knee joint, or we think about the cartilage on our nose or the cartilage in our ear, but there's a ton of cartilage throughout our body, and the rib cage is one of these areas. If we look with our anatomy tool here on the front of the chest, this kind of lighter gray color is going to be cartilage. So specifically, it's called costal cartilage. The bones of the ribs articulate with the backside of the spine, and then they wrap around and are anchored into the sternum in the front of the chest, sort of indirectly through this connection of the costal cartilage. As we work our way down the rib cage, we see that cartilage becomes bigger and bigger and kind of constitutes a bigger portion of that anterior or front component of the chest wall. Herbert, of course, tended to be grabbing more on that left lower abdomen, kind of right around this area. And you can see there's a lot of this costal cartilage right there in this area. Of course, right behind that area is going to be where the spleen, the kidney, and important organs live. And so that's why, honestly, I was reminded of what happened with Andrew Luck when this occurred. And it wouldn't have been surprising to me if he would have had an organ injury. But thankfully, the rib cage did its job. His body protected his organs. And we're just dealing with this cartilage. Cartilage isn't going to fracture in the traditional sense of what we think of with like a bone fracture. And oftentimes when we're dealing with something where we hear cartilage fracture around the ribs, it's more of a cartilage separation or a cartilage tear or cartilage pull than it is like the cartilage just completely snapped into two different pieces. Cartilage is obviously much softer than bone, and so it's going to have more flexibility. That's part of why it's here in the rib cage, because of course, as we breathe and relax, we need to expand our rib cage and relax it. And if it was just bone on bone, there wouldn't be that flexibility. So this costal cartilage gives us some of that flexibility to expand the rib cage, which means it's flexible, it's a little bit more pliable. So oftentimes these injuries are going to be more at the junction where the rib actually meets up with that costal cartilage. There's going to be a little sort of joint right here. And you can have tearing where that cartilage kind of gets pulled away, or maybe you get a little bit of a rip in that cartilage, but it's not necessarily like two ends of a bone that are broken apart. Management of these is similar to rib fractures, unless they're severely displaced or there's other complications, things like collapsed lungs or something called a flail chest. A lot of it is just symptom management. It's pain management. So the return time really is dependent on when that pain starts to improve. When somebody has bad rib fractures from a trauma in the hospital, we'll actually be aggressive with pain management because the more your ribs hurt, the less you expand your lungs, the less air you get in, and so you are higher risk of things like pneumonia, respiratory complications, if you have severe pain from your rib injury. But that is, of course, where the second part of this story with the lawsuit comes into play here and is obviously on people's mind. Because, of course, as we remember, Tyrod Taylor, former Chargers quarterback, suffered rib injuries, and in order to help play through the pain, was given an injection, what we call an anesthetic block or a nerve block, before the games to improve the pain so that he could have better symptom control and go play. And while at the time he didn't seem too upset about it, now of course we found out that there is in fact a lawsuit, and ironically, it's the same head team physician for the Chargers who's currently managing Herbert. So I can understand why people are a little bit apprehensive about this and wondering what the heck is going on. This image shows a cross-section going through the front of the chest wall. So of course we have our rib right here, we have skin on the outside, we have some subcutaneous fat. We're going to have some muscles, specifically the intercostal muscles that run between the ribs. But then importantly, we're going to have this bundle of nerve and blood vessels. We call it the intercostal nerve because it's in this intercostal space. The intercostal nerve is on the bottom side of the rib and supplies the pain innervation for our ribs, for these muscles, for that area of our chest. Nerves, of course, transmit pain signals. So if you can use a medicine like a local anesthetic to basically numb or shut off that nerve, You still technically have the source of the pain present, but the pain signal can't get back to the spinal cord up to the brain, and so you don't perceive the pain. We do nerve blocks all over the body for things like pain control before a surgery or maybe a in-office procedure. So nerve blocks in and of themselves are not a necessarily uncommon or typically complicated thing. But with any procedure, there are always going to be risks of complications, and it's no different with these intercostal nerve blocks. Looking at a different side profile, of course, directly behind those ribs is the lung. And we're talking about very, very short distances here between the nerve that you're trying to put numbing medicine around and the lining of the lung. When you do these nerve block injections, they can be done either with just palpation, where you push on the rib and then try to align your needle in the right place, or in my opinion, in a better way, it can be done with ultrasound, where you basically see where the needle is going and visualize it the whole time. When you do these just palpation guided, oftentimes you're kind of going down to feel along where the rib is and then just sort of try and tuck the needle right up on the bottom side of that rib to try and hit that nerve. But you can see if you're doing this without any sort of imaging guidance, it can be easier to go too far and then you poke a hole in that lining of the lung. You let air into that space around the lung, pressure builds up and the lung collapses, which is of course what happened with Tyrod Taylor. Now the merits of the lawsuit are far beyond anything that we're aware of in the public or for me to speculate on in this video. From the reporting we do have though, it seems like some of this comes down to this idea of informed consent. Basically, whenever we do any sort of medical procedure, surgery, even something basic like a knee cortisone injection, we have to go over this informed consent with the patient. We have to tell them about the risks, the benefits, the alternatives, basically this long list of things so that they can make an informed decision. And part of that is talking about the risks of the procedure. Nobody, of course, other than who was in the room at the time, knows exactly what was said during that informed consent process and if something like a risk for a collapsed lung was ever addressed. But even if the informed consent process was done perfectly and everything was accurately disclosed, that still doesn't protect a medical provider from being sued by a patient for malpractice. So there's a lot of different factors here at play that, like I said, go well beyond, frankly, anybody in the media speculating about this should be able to say without knowing more of the facts. Interestingly, a previous story about this whole thing specified that while the injection that Tyrod Taylor received is not uncommon, it carries a risk because the doctor injects without seeing where the needle is going. That's definitely one way of doing it, and certainly physicians who aren't trained in how to use ultrasound might do it this way, but preferably when you have image guidance with ultrasound, you can see where the needle's going, you can visualize the lung, and you can try to make sure you don't go far enough to hit the lung. But just because there might be a preferred way for one person to do the procedure doesn't mean that doing it without image guidance or doing it another way is just objectively bad or objectively wrong. This is a study from 2001 that looked at the incidence of these collapsed lungs after doing intercostal nerve blocks for rib fracture pain control and basically found a pretty high rate. Overall incidence per patient was 8.7%, which is definitely something that's high enough that you would need to disclose if you were doing this procedure. Bringing this all back around to Herbert, keep in mind that just because one person might be officially the head team physician for a professional team, doesn't mean they're the only physician that's involved in athlete care. Oftentimes there's multiple specialists, multiple providers, potentially somebody who has experience with ultrasound guided intercostal blocks, other people who actually might be the ones that are doing the hands-on work. So just because it says that he's the head physician, while yes, that person is responsible, there's likely other people often involved with all these teams. Secondly, we're not doing these things for pain control unless we absolutely have to, and certainly in a situation like getting back to a pro sporting event, there's sort of a different threshold than just going about your everyday life. But of course, with these procedures, even if you use something like ultrasound, there is still a very real risk of a complication like this occurring. So we try to do the least invasive things possible to get that desired outcome. You can do different medications or creams or patches and still get good pain relief. Do those before you do the injection. Certainly if I'm Justin Herbert or the team of people around him, I'm at least asking these questions and seeing if this injection is absolutely something that's needed to get him through the game. Can it be done with image guidance if it wasn't done that way with Taylor? I suspect Herbert's going to play this weekend, to be honest. When we look at the data, usually these are somewhere on like the 1 to 3 week mark in terms of return to play. And as we saw Herbert demonstrate in the game, he's an extremely tough dude. We saw some good footage of him in practice where he's already doing some thoracic extensions and sort of mobilizing his chest a little bit. So I think things are trending towards him having a good chance of playing. And certainly if he doesn't this weekend, I would be shocked if we don't see him back for week 4. So that's it for the video, everybody. I hope this was educational to talk about these rib cartilage fractures and just shed a little bit of insight on kind of what might have happened with the Tyrod Taylor situation and what we do to manage pain and some other parts of that background. Let me know as always any questions or comments down below, and until next time, we'll see you later. Bye.